the sun, looking out for #1. California, here we come, right back where we started from.
I think the con is that it's not accessible to everybody. I mean, it's only accessible to those people who have, they either have a lot of money to pay for their own health insurance, or they have an employer that pays for their health insurance. So I think the quality of care you get is based on your ability to pay.
Do you think you've heard anything good in particular about the American healthcare system?
No. I was really thinking that I was trying to reach, but no.
I have a disabled son who was injured in a car accident 7 years ago, and he was in a hospital in Kansas City. Fortunately, it was a work-related accident. He had workers' comp, and he was well taken care of. But there was a young man about his age, he was 23, a young man about his age that came in, and he was shot in the back, and they sent him home a day later in a rickety old wheelchair with no physical therapy, paralyzed from the waist down, and basically that was his life from there on out. So, looking at the difference in care that my son got versus another mother's son, it was a grave injustice. I can give you another example, a personal example, and that is that 3 years ago I had lap band surgery. And the reason I'm down here today is I was in Tijuana for a follow-up visit with my doctor, because I went to a doctor in Portland that does lap band surgery, and they were going to charge me $35,000, and it's not covered under my insurance. The doctor down here charged me $7,500.
Well, I'll tell you the truth. 7 years ago, I got a big bump down here.
Okay.
Jogging, I just figured it was a hernia.
Mm-hmm. Makes sense.
Well, it's before I became 65 years old, so I went to a hospital. They refused to take me because of the fact that I didn't have insurance at the time, right? I was here at the time, so I went to Florida because I travel around. There, they told me, well, we don't know what it is, but we'll check it. So they checked it and said it's cancer. What he said is due to the fact that I waited so long, because I couldn't get insurance.
Okay.
Or the hospitals wouldn't take me, let me put it that way.
Okay.
Due to that fact, he said that it went inside me, and I only had 3 months to live.
I stayed at the Hospital Angeles down in Tijuana. It was a brand new hospital. There were probably 6 employees for, taking care of me. There were nurses everywhere, and the quality of care that I got there, I felt more confident down there than I felt ever in a hospital in the States. And I also lived in Singapore, and I would say that same experience was true in Singapore, is that I got good quality health care at low cost.
In the UK, we have sort of national health, although additionally we have private medical insurance as well. Medical.
We do personally. Lots of people don't, because it's very, very expensive to have private medical cover. But lots of companies offer it. You're working, and my husband had it when he was employed. So he continued it after his retirement. But as you get older, the premiums will get higher and higher. So consequently, we pay a lot of money. Fortunately, we haven't had to use it, but you never know when that day is going to come. I worked for the NHS for a long number of years, and I could see the difference, as the years progressed. But I think if you're an emergency, then you can't really beat the NHS treatment because you'll be in immediately.
Okay.
But if you're not for non-emergency, or you will have to wait, still have to wait. And as I say, you don't get necessarily, some continuity of care. I still feel that the standards within the hospitals aren't as good as I would like to see them. The cleanliness, although they are improving again on that.
Cons, very long wait times.
Okay.
Cons.
Approximately how long?
my girlfriend wanted to get something done in October, and the first guy in Montreal that can do it is in May. So
Really?
we're talking 5 months,
Okay.
and it's pretty bad.
Renewing your healthcare card, that's another thing. It's really quick and easy and seamless, and that's another pro.
To me, the concept of 401ks and how you have portable healthcare, portable retirement accounts, it feels like healthcare should be the same thing, that it shouldn't be, tied to a relationship between an employer and an employee, that if you had healthcare that was portable from employer to employer, with employers maybe contributing to the cost of that, but that it's linked to the individual like your 401k is, and you can roll it over as you go from employer to employer, so that you have that continuity of coverage, and then your employer helps subsidize that.
I'd like to see socialized medicine.
Okay.
I'm a definite proponent of that.
Bottom line, if people need it, they should be able to have it. And that's just bottom line. Across the world, it should be like that. I think if there's a medium that can allow for both, where the doctor gets compensated appropriately and the quality of the healthcare is good, then I think that's the medium we should be reaching for, at least.
Whenever they take 10 cents out of your paycheck, you complain, So irregardless whether it's like that. But if they stop to realize the benefits that would happen,
My husband and I wouldn't mind paying a higher tax so that people, the working poor and the indigent could get some kind of decent health care. We wouldn't mind paying higher taxes. We're probably not the norm though. Everybody thinks of their own situation and they don't feel a responsibility to the community. And my husband and I do. I was raised to have a responsibility to my fellow human beings. And not many people seems like feel that way anymore. I hope the younger people like you understand that the lowest economic level of our country determines how we are as a people.